This is case study, Parkinson's disease early onset. Post-surgery home visit. Patient's name is Ted. He is a 38-year-old male. Client background. At 32 years old, he was diagnosed with young onset Parkinson's disease. He originally presented with unusually severe motor complications. His dyskinesia was so severe that he developed rhabdomyolysis due to the dyskinesias he had. 2 weeks ago, he had deep brain stimulation implanted, and his Parkinson's symptoms have improved dramatically, and his motor complications are significantly improved. The patient's past medical history includes young onset Parkinson's disease at age 32, rhabdomyolysis due to dyskinesia, deep brain stimulation implanted, he has no known allergies, and he currently is a DNR/DNI. What is rhabdomyolysis? What are the signs and symptoms of rhabdomyolysis? What is the cause of rhabdomyolysis in Parkinson's patients? Here are the patient lab results at discharge. What labs would be abnormal if Ted would have rhabdomyolysis? Now moving on to the physical assessment. During today's visit, Ted is alert and oriented ×3, in good spirits. He experiences occasional resting tremors of his left forearm, which is a little more evident when he gets excited. Although Ted is able to ambulate independently, he does experience bradykinesia and freezing gait. He has difficulty with trying when he was asked to take a small walk. He also complains of dystonia in his hands and feet. Client's dyskinesia appears to be well controlled. Ted states, "This stimulator in my brain is amazing. My unintended, involuntary, and uncontrollable movements are much lesser." He denies swallowing difficulties at this time. The client's incision is clean and dry. He has 32 staples that are intact. Do all patients with Parkinson's disease qualify for deep brain stimulation? Explain why or why not. Describe the surgery and the education for the patient prior to the surgery, and what assessments would you focus on before and after the surgery? Ted's current vitals are 122/80, regular pulse of 74, 18 respirs of non-labor, temperature 97.9, pain 3 of 10. What questions would you ask to assess his pain further? What recommendations can you give the patient to help manage his pain? Ted lives alone in a second-floor apartment. He does not have a family as he was raised by his grandfather who passed away last year. He is in a relationship and his girlfriend helps as much as she can, but she is active in the military and is deployed often. Ted outright denies depression, but sometimes he does state, "Sometimes I feel anxiety before I meet my girlfriend. I'm afraid that she will leave me since I'm having difficulties during intimate situations." He says he is mostly in good spirits. He inquires about medications for erectile dysfunction as he currently has difficulty with sexual desire and complains of low libido. His current medications are Sinemet 25-250 QID PO and benztropine 4 milligrams at bedtime PO and acetaminophen as needed. His treatments are to change the dressing twice daily until incision is dry. 1 week post-surgery, leave the incision open to air. 2 weeks post-surgery, remove the staples. Activities: physical therapy 3 times daily for 2 weeks, occupational therapy to complete home safety evaluation. Nursing care plan includes provide dressing changes, remove staples, assess patient's fall risk, assess patient's depression, and refer to support groups as needed. What are some of the primary levels of prevention, secondary levels of prevention, and tertiary levels of prevention for TED? How about expanding this out to the population levels of prevention? What are some of the primary, secondary, and tertiary levels of prevention for the population? What are some of the resources available for Parkinson's patients in your community? What are some of the local resources? Some of the state and federal resources, as well as the possibility of having virtual or internet resources. What are 3 nursing interventions to address the holistic care of this particular client needs? What are some of the current evidence-based recommendations for additional complementary treatments for symptom management for Parkinson's patients? Thank you for viewing this case study, and we wish you good luck, as well as have a great presentation.